Hello and welcome. Today, we're going to talk about something that is very important for your health as you get older. It is something you may not think about every day, but it affects your bones, your muscles, your teeth, and even your energy. That something is calcium. Many people believe that if they are not in pain or if nothing feels wrong, everything must be fine. But calcium deficiency, or not getting enough calcium, can be a silent problem. You may not notice it at first. You may only feel small things like tiredness or a little pain in your legs. But over time, not having enough calcium can lead to serious problems. As you get older, your body goes through changes. Your bones slowly lose strength. Your body does not absorb calcium as well as it used to. Hormone changes, medications, and some health problems can also make it harder to keep enough calcium in your body. This is why calcium is especially important for seniors. Calcium is a mineral. Your body stores most of it in your bones and teeth. It keeps them strong, but calcium also helps your muscles move. It helps your heart beat. It helps your nerves send signals. It does many jobs inside your body every single day. Now, here is something important to know. If your body does not get enough calcium from your food or supplements, it will take the calcium out of your bones to use it for other things. That weakens your bones, even if you do not feel anything at first. So in this video, we are going to look at 6 common signs that might mean your body is low on calcium. Some of these signs are easy to miss. Some may seem like part of aging. But if you notice them, it is a good idea to speak with your doctor or get your calcium levels checked. After we go through these signs, we will also talk about how to make sure you are getting enough calcium. We will look at food sources, supplements, and simple tips you can use every day. So let us begin. First, we will talk about why calcium is so important for seniors and why it becomes harder to keep enough calcium in the body as we age. Calcium is one of the most important minerals in the human body. It is best known for building strong bones and teeth, but it also plays a key role in helping muscles work, nerves send messages, and the heart maintain a steady rhythm. Every single day, your body uses calcium to carry out these important functions. Your bones hold about 99% of the calcium in your body. The remaining 1% is found in your blood, muscles, and other tissues. Even though that last 1% seems small, it is very important. Your body needs a steady supply of calcium in the blood to keep things running smoothly. If there is not enough calcium in your blood, your body will take it from your bones. This process happens without you knowing. Over time, if your body keeps pulling calcium from your bones, the bones become weak and thin. This condition is called osteoporosis. Osteoporosis makes bones fragile. It increases the chance of breaking a bone, even from a small fall or bump. For seniors, a broken bone can be life-changing. It can affect your ability to walk, stay active, or live independently. But why does this become a bigger problem as we age? As you grow older, your body becomes less efficient at absorbing calcium from food. That means even if you eat the same way you did when you were younger, your body may not take in as much calcium. In women, calcium levels drop quickly after menopause because of lower estrogen levels. Estrogen helps protect bone density. In men, calcium loss is usually slower, but it still happens with age. Other things can also lower calcium in the body. Certain medications, like steroids or drugs for acid reflux, can reduce calcium absorption. Some health conditions, such as kidney disease or vitamin D deficiency, can also interfere with how you use calcium. Vitamin D is another important part of this picture. Your body needs vitamin D to absorb calcium from the food you eat. Without enough vitamin D, even a calcium-rich diet will not help your bones. This is one reason doctors often check both calcium and vitamin D levels in older patients. Now let us talk about how much calcium you actually need. For most seniors, the recommended amount is around 1,200 milligrams of calcium per day. That is about the amount you get from 4 cups of milk. But not everyone drinks milk, and some people avoid dairy. That is why it is important to learn about different sources of calcium, which we will cover later in this video. Let us compare that to something real. 1 cup of cooked kale gives you about 90 milligrams of calcium. A slice of cheddar cheese has about 200 milligrams. A small can of sardines with bones gives you around 300 milligrams. You would need to eat several servings of these foods to meet your daily needs. Now you can see why it can be hard to get enough calcium without thinking about it. It is not just about drinking milk. It is about planning your meals and maybe taking a supplement if your doctor recommends one. Before we talk about how to add more calcium to your diet, we need to talk about something just as important. What are the signs that you may already be low on calcium? You may be surprised at what they are. Some are physical. Some affect your energy or your mood. Some affect your teeth and your bones. But the good news is that these signs can act like early warnings. They give you a chance to take action before more serious problems happen. In the next part of the video, we will go through 6 common signs that may mean your body is low on calcium. These are signs you should not ignore, especially if you are over the age of 60. Let us begin with the first one. Sign 1. Frequent muscle cramps or spasms. Have you ever been resting and suddenly your leg or foot starts to cramp? It feels tight, painful, and hard to move. Muscle cramps can happen to anyone, but when they happen often, especially at night, it may be a sign that something in your body is off. One possible cause is low calcium. Calcium helps your muscles contract and relax properly. When there is not enough calcium in your blood, the muscles can become too sensitive. They may twitch, cramp, or feel stiff. These cramps can happen in the legs, feet, hands, or even the back. Some people feel it as a sharp pain. Others feel a dull ache that does not go away quickly. You may notice it most when you are at rest or sleeping. That is because your body is more relaxed at those times, and changes in calcium levels may show up more clearly. If you wake up often with leg cramps or feel tightness in your muscles during the day, it is worth paying attention to. Muscle cramps are not always caused by low calcium. They can also happen if you are dehydrated or have low potassium or magnesium. But if cramps happen often and are not going away, you should talk to your doctor and get your calcium levels checked. It is a simple blood test. To help your muscles feel better, you can try stretching, staying active, and drinking more fluids. But if low calcium is the cause, fixing that will give you real relief. Sign 2. Weak or brittle nails. Another sign of low calcium is something you may notice every day: your fingernails. If your nails break easily, peel, or seem soft and thin, it might mean your body is not getting enough calcium. Just like your bones, your nails are made of protein and minerals. Calcium helps give nails their strength. When your calcium levels are too low for a long time, your nails can lose their firmness. They may grow more slowly, look dull, or split at the edges. You may also notice changes in your toenails, although fingernails usually show it first. Of course, nail problems can also come from other causes like poor diet, frequent hand washing, or certain health issues. But when brittle nails appear along with other symptoms, they may point to calcium deficiency. Some people try to fix weak nails with creams or special nail products. These might help the outside, but they do not treat the real problem inside your body. If low calcium is the cause, the only way to make lasting changes is to improve your calcium intake and make sure your body is absorbing it well. To give you an idea of what helps, 1 cup of plain yogurt has about 450 milligrams of calcium. That is more than a third of your daily need. A handful of almonds is about 75 milligrams. If your nails are showing signs of weakness, try eating more foods like these and speak with your doctor about testing your calcium level. Sign 3. Fatigue and feeling tired all the time. Everyone feels tired sometimes. But if you feel tired almost every day, even after resting or sleeping well, it may be more than just getting older. Fatigue or a constant lack of energy can be a sign that your body is missing something important. One possible cause is low calcium. Calcium is needed by almost every cell in the body. It helps your muscles move, your nerves send signals, and your heart beat regularly. When your calcium levels are low, your body may struggle to perform all these basic tasks. As a result, you may feel weak, slow, or just worn out. This kind of tiredness is not the same as being sleepy. It is a deep feeling of low energy that does not go away easily. You may find it harder to do simple tasks, like walking upstairs or doing light chores. Some people say they feel like they are dragging themselves through the day. Low calcium can also affect your mood. It may lead to feelings of sadness, low motivation, or even mild depression. That is because calcium helps your brain work properly. If your brain cells do not have enough calcium, they may not communicate as well. This can affect both your energy and your mood. Keep in mind, fatigue can be caused by many things, not just calcium. It could be related to poor sleep, low iron, thyroid problems, or other health conditions. But if you notice that your fatigue comes along with other signs in this video, it may be a good idea to have your calcium levels tested. To compare, a bowl of cooked spinach gives you about 240 milligrams of calcium. If you eat that along with some canned salmon or tofu, you can boost your calcium levels in a healthy way. This may help your energy improve over time. If you are feeling more tired than usual and it lasts for more than a few weeks, do not just blame it on aging. Your body might be telling you it needs more calcium. Sign 4. Numbness or tingling in hands and feet. Have you ever felt a strange tingling in your fingers or toes? Or a feeling like your hands or feet are falling asleep? Numbness or tingling can be a sign of poor circulation, nerve problems, or low calcium. When your body does not have enough calcium, the nerves that carry messages to your brain and muscles may not work well. This can lead to sensations like pins and needles, especially in the hands, arms, feet, or legs. Some people describe it as a light buzzing or crawling feeling. Others say their fingers feel weak or clumsy. You might notice it more when you are resting or when you wake up in the morning. This sign is easy to overlook, especially if it comes and goes. But if it keeps happening, or if it gets worse over time, it may be your body's way of telling you that it is not getting enough of what it needs to function well. This tingling is caused by the way calcium supports your nervous system. Your nerves use calcium to carry signals. If there is not enough calcium, those signals may be interrupted or delayed. That leads to numbness, tingling, or even muscle weakness. To help your nerves work properly, your body also needs enough magnesium and vitamin D. All three work together. For example, vitamin D helps your body absorb calcium. Magnesium helps your body use calcium in your cells. You can get about 200 milligrams of calcium from 1 cup of fortified orange juice. A cup of cooked broccoli gives you about 60 milligrams. Including these foods in your meals can support nerve health. If you notice numbness, tingling, or strange sensations in your hands or feet, talk to your doctor. It could be from many causes, but checking your calcium levels is a good place to start. Sign 5. Tooth decay or dental problems. Your teeth are made of some of the hardest material in your body. But even teeth need support to stay strong. And calcium plays a big role in that. If your body is not getting enough calcium, one of the places it may show up first is in your mouth. Tooth decay, gum disease, and even loose teeth can all be signs of calcium deficiency. That is because your teeth are part of your skeletal system. They rely on calcium to stay firm and healthy. When your body does not have enough calcium in the blood, it may start to pull it from your teeth and jaw bones, just like it does with your larger bones. You might notice that your teeth feel more sensitive, especially when eating hot or cold foods. You may also see more cavities, even if you are brushing regularly. Some people find that their gums bleed more often when brushing, or that their dentures do not fit as well because of changes in the shape of the jawbone. For older adults, dental health is often closely linked to overall health. If you start having more dental problems than usual, or if your dentist tells you that your jawbone looks thinner, ask about your calcium intake. You may need more than you are currently getting. To help compare, 1 cup of low-fat milk gives you about 300 milligrams of calcium. A half cup of ricotta cheese gives you over 330 milligrams. Adding just a few servings of these foods to your day can help protect both your teeth and bones. Keep in mind that calcium is not the only part of good dental care. Brushing, flossing, and regular checkups are important. But without enough calcium, even good habits may not be enough to prevent problems. If you are seeing more issues with your teeth or gums, and especially if they come along with any of the other signs we have discussed, that could mean your calcium levels are low. Sign 6. Bone fractures or slow-healing bones. The most serious and dangerous sign of low calcium is weakened bones. When your body has too little calcium over a long period, your bones become fragile. That makes them more likely to break from a fall, a bump, or sometimes even just from walking or bending. Bone fractures are common among older adults, but they should never be taken lightly. A broken hip, wrist, or spine can lead to months of recovery. It can also lead to loss of independence and lower quality of life. If you have had a bone fracture recently, or more than one in the last few years, you may want to ask your doctor to check your calcium and vitamin D levels. Weak bones may not heal as fast if they are not getting the nutrients they need. Calcium is the building block for your bones. But remember, your body also needs vitamin D to help absorb the calcium and send it to the bones. Without enough of both, bones not only become weaker, they also take longer to repair after an injury. You can get vitamin D from sunlight and from food like salmon, eggs, or fortified cereals. A small piece of salmon, about the size of a deck of cards, can give you around 500 to 600 IU of vitamin D. That helps your body use the calcium you eat. As we said earlier, most seniors need around 1,200 milligrams of calcium each day. If you are not eating enough foods with calcium, or if your body is not absorbing it well, your bones may slowly lose density. You cannot always feel this happening, which is why bone scans are important for older adults. If you have not had a bone scan recently, ask your doctor about it. It is a painless test that can show if you have bone loss. It can help catch osteoporosis early, before a fracture happens. In short, if you have had a recent fall and broke a bone, or if your doctor says your bones are not healing well, calcium may be part of the issue. Do not ignore this sign. Now that you know the signs of low calcium, you may be wondering what you can do about it. The good news is that calcium deficiency can often be prevented or corrected with changes in diet, lifestyle, and sometimes supplements. This section will explain how to make sure you are getting enough calcium each day and how to help your body absorb it properly. Daily calcium needs. First, let us talk about how much calcium you actually need. For most seniors, the recommended daily intake is about 1,200 milligrams of calcium per day. That may sound like a lot, but you can meet that amount if you choose your foods carefully. To give you an idea, 1 cup of milk gives you about 300 milligrams of calcium. That means 4 cups of milk would give you your full daily amount. But not everyone drinks milk, and that is okay. There are many other sources of calcium, both from animal and plant foods. Food sources of calcium. Here are some common foods that are high in calcium, along with the amount of calcium they contain. 1 cup of plain yogurt, about 450 milligrams. 1.5 ounces of cheddar cheese, around 300 milligrams. 1 cup of cooked collard greens, over 260 milligrams. 1 small can of sardines with bones, over 300 milligrams. 1 cup of cooked broccoli, about 60 milligrams. 1 cup of fortified orange juice, around 300 milligrams. Half a block of firm tofu, up to 400 milligrams. A handful of almonds, around 75 milligrams, as you can see. By combining a few of these foods each day, you can meet your calcium needs. For example, a breakfast of yogurt and fortified orange juice, lunch with tofu and spinach, and dinner with salmon and broccoli can add up to the full daily amount. Supplements. When and how to take them. Sometimes diet is not enough. If you have trouble eating calcium-rich foods, or if your doctor says your calcium levels are low, you may need to take a supplement. There are 2 main types of calcium supplements: calcium carbonate and calcium citrate. Calcium carbonate should be taken with food. It needs stomach acid to be absorbed properly. Calcium citrate can be taken with or without food. It is easier for many older adults to absorb, especially if you take medications that lower stomach acid. Your doctor can help you decide which type is best for you. Most people do not need more than 500 to 600 milligrams of calcium at one time. If you need more than that, it is better to split it into 2 doses, one in the morning and one at night. Also, more calcium is not always better. Taking too much calcium can cause constipation, kidney stones, or problems with other minerals in your body. That is why it is important to stay within the recommended range unless your doctor says otherwise. Vitamin D and calcium absorption. Vitamin D is just as important as calcium when it comes to bone health. Without vitamin D, your body cannot absorb calcium properly, no matter how much you eat or take in supplements. Your skin makes vitamin D when it is exposed to sunlight. But as you age, your skin becomes less efficient at making vitamin D if you do not spend much time outside, or if you wear sunscreen or cover your skin. You may not get enough from the sun. You can also get vitamin D from food. Here are some good sources: a 3-ounce serving of cooked salmon, around 500 IU, 1 large egg, about 45 IU, fortified milk or plant milk, about 100 IU per cup, fortified cereal, usually 100 IU per serving. The recommended amount of vitamin D for most seniors is around 800 IU per day. That is about the same as a small piece of salmon and a glass of fortified milk combined. Some people may need more if they have low blood levels. Your doctor can check your vitamin D level with a simple blood test. If needed, vitamin D supplements are available and often come in combination with calcium. Make sure to take the right dose and form, as directed by your doctor or pharmacist. Other tips to support calcium intake in addition to eating well and taking supplements if needed. Here are some tips to help your body use calcium more effectively. Stay active. Weight-bearing exercises like walking, dancing, or climbing stairs help keep your bones strong. Limit caffeine and alcohol. Too much caffeine or alcohol can interfere with calcium absorption and bone health. Do not smoke. Smoking weakens bones and reduces calcium absorption. Eat enough protein. Protein helps build bone and muscle, but balance is key. Try to include lean meats, beans, or dairy in your meals. Check your medications. Some drugs, like steroids or certain diuretics, may lower your calcium. Talk to your doctor if you are unsure. We have covered a lot of information today, and I hope it has helped you understand why calcium is so important, especially as we grow older. Let us take a moment to review the key points. Calcium is more than just a mineral for your bones. It supports your muscles, your heart, your nerves, and even your teeth. Your body needs calcium every day to stay strong and function well. But as you age, your body becomes less efficient at absorbing calcium. You may also eat less, take medications that interfere with absorption, or face changes in hormones that affect bone health. That is why calcium deficiency is common in older adults, and it can happen without you realizing it. Now let us go over the 6 signs that may point to low calcium levels. First, frequent muscle cramps or spasms. If your legs, feet, or hands cramp often, especially at night, it might be your body's way of telling you it needs more calcium. Second, weak or brittle nails. If your fingernails break easily or seem soft and thin, it may mean your bones and nails are not getting the calcium they need. Third, fatigue and feeling tired all the time. Calcium supports nearly every system in the body. Without enough, your energy drops and you may feel worn out for no clear reason. Fourth, numbness or tingling in your hands and feet. This strange feeling might mean your nerves are not working well, and that could be caused by low calcium. Fifth, tooth decay or dental problems. If you notice more cavities or your teeth feel weaker, your body may be taking calcium from your teeth to keep your blood levels steady. And sixth, bone fractures or slow healing bones. If your bones break easily or take longer to heal, this could be a sign of long-term calcium deficiency. This is a serious warning and should not be ignored. If any of these signs sound familiar, talk to your doctor. A simple blood test can check your calcium and vitamin D levels. Catching the problem early can prevent more serious issues down the line. The good news is, there are many ways to get enough calcium. You can eat foods like yogurt, leafy greens, tofu, and sardines. You can drink fortified orange juice or almond milk. If needed, you can take calcium supplements, but only as your doctor advises. And do not forget about vitamin D. It helps your body absorb the calcium you eat. Remember, most older adults need about 1,200 milligrams of calcium and about 800 international units of vitamin D each day. That could be a cup of yogurt, a serving of salmon, some almonds, and a glass of fortified juice. Small choices that add up. Your body will thank you for paying attention to these needs. You will feel stronger, move easier, and lower your risk of serious problems like fractures and bone loss. So, do not wait. Take care of your bones and your body today. Add a few calcium-rich foods to your meals. Spend a few minutes outside for sunlight and vitamin D. Stay active, stay informed, and most importantly, listen to your body. Thank you for watching. If this video helped you, consider sharing it with a friend or family member who may also need this information. Your health matters, and it is never too late to start taking care of it.